Health officials in Kakamega County, Western Kenya, are investigating a suspected case of Ebola. The patient had recently traveled to eastern Uganda to visit relatives. Mumias West Disease Surveillance Coordinator Boaz Gishana said in a statement released on Friday that the patient is currently at St. Mary's Hospital Isolation Unit awaiting laboratory tests.
We are on the Trans-Africa Highway that comes from Mombasa all the way to Sudan. And I would like to say that we are ready, and you saw it during the COVID-19. You see, the approach is similar, that we have a task force that is ready and the staff have been put on the alert to make sure that any suspected cases are quickly identified and isolated, tested and treated accordingly. And this office where we are seated, you remember, was the headquarters of the COVID response in the western half of Kenya. We developed protocols to assist all the counties in this region, over 20 counties actually.
Moi Teaching and Referral Hospital CEO Wilson Aruasa further applauded the Ministry of Health, WHO and KEMSA for equipping the hospitals with enough PPEs, saying they will provide a conducive environment in handling suspected cases of serious diseases like Ebola.
I can assure you and assure the public that we are ready also, and working with the Ministry of Health and the counties, particularly the border counties like Busia, Trans Nzoia, West Pokot and others. Including now, I think the case you are referring to was in Kakamega, which is a region also that MTRH covers. We are ready and prepared. You know, the lessons that we learned in COVID-19, the need for preparedness, the need for adequate staff training, adequate PPEs, personal protective equipment, which we have more than enough actually. Even monitoring what is happening in Uganda, we've been watching on Uganda TV stations. And they're also doing a good job at it, I must say, and probably issues about vaccination are the things that need to be addressed. But in terms of the actual case management and the prevention of the disease, I think the region, the East African region, really is prepared.
Last month, Kenya put health officials on the border on high alert after the World Health Organization WHO said it was investigating a suspected case of Ebola in the Democratic Republic of Congo.
And we want to also laud, beyond our government, the World Health Organization. They also come in handy to support us, and we appreciate that.
Uganda is currently battling a rise in infections and deaths caused by the Sudan strain, which currently has no vaccine. Health officials have urged residents to adhere to measures to prevent infection and spread of the virus. Previous outbreaks and responses have shown that early diagnosis and treatment, optimized supportive care with fluid and electrolytes repletion, and treatment of symptoms significantly improve survival rates of the deadly Ebola virus disease. The disease is usually introduced into the human population through close contact with blood, secretions, organs or other bodily fluid of infected animals such as fruit birds, chimpanzees, gorillas, monkeys, forest antelope or porcupines found ill or dead or in the rainforest. It is transmitted from person to person through contact with body fluids. Kind Stefano, Ebru TV.